Let me tell you how I got into healthcare. So I read Michael Harrington's book, The Other America, back in 1962 when I was in high school, and it said there were 40 to 50 million people in this country that were really not benefiting from the American dream, and they were basically the poor and the people of color. And that really struck me, and when I read that book, and then I realized over the next several years that John Kennedy also had read that book, and he developed this war on poverty. Well, he started it, and Lyndon Johnson carried it on, and it was making a huge difference in communities, particularly communities of color. And that resonated with me because where I grew up, we didn't have any people of color, and I was really interested in what was going on throughout the states, and seeing the changes that were made, and knowing that this world was much bigger than what I was seeing in my little hometown. So that sort of stuck. When I was 8 years old, my dad took me to a Green Bay Packer game, and that's when I saw the first African American in my life, and his name was Bobby Mann. He was a running back for the Green Bay Packers. First African American I'd ever seen. And I asked my dad about that as we were walking home, and he said, yeah, he can only come into town during the football season, and he then needs to leave when the season is done. And he can't live in town, he has to live on the outskirts of town. And I reflected to my dad, that doesn't seem fair. And my dad said, no, that isn't fair. So I'm hoping that your generation actually does something about that. So that was sort of a seminal point where I had to really think about, oh, there's some expectations that my generation maybe can do something to make things better for a lot of people. So that was certainly one particular incident. But certainly as I became Commissioner of Health, and we started asking folks around the state what creates health, and recognizing that many populations, particularly of color and American Indians, are not benefiting from all of the benefits of the state, it really became clear that we needed to really address health equity in a really proactive way. Just looking at the data, looking at the pain that people are under, looking at the situations that people don't really have any opportunities to be healthy. They're in situations where they're really refrained from benefiting from all of the things in our state. We've been working with, even before I became health commissioner, we were really working with communities about how to create health and how to deal with disparities. But becoming the health commissioner gave me a platform to really take it to a different level and get some visibility on this issue. So we developed the Advancing Health Equity Report, which identified the fact that disparities are a huge problem in this state, and that they're really not about access to medical care and personal choices. It's really about the socio-political climate, the socioeconomic climate that people are in. So we said, if we're going to really be a healthy state, we've got the best medical care system in the country. We really overall are a very healthy state on average, but we have these huge disparities that and as our population is changing, unless we really address those disparities, we'll not be able to maintain our status as a healthy state. So in order to do that, we have to deal with health equity. And the issue that most people don't want to talk about is race, and the disparities we have in race, and the lack of opportunities that people of color and American Indians don't have because of some of the policies that are in place that have been put there many, many years ago, but are impacting them negatively. And so we decided that that's where we would lead. We would lead with a discussion about race as one way of getting at all of the policies and the systems that benefit whites at the expense of people of color and American Indians. Well, certainly when we were looking at the Central Corridor light rail, they did not pay attention to the people in the middle of that line, particularly people of color in the middle of the line, low-income folks, where there are no stops. And really to see the community come forward and say, we're being disadvantaged by that policy that says you have to move people as rapidly as possible. You're paying attention to only one criterion. That's the efficiency of it. You're not paying attention to the population needs. And so with their advocacy and their organizing and their really creating a movement, they were able to get 3 stops. Not only that, they actually changed federal policy on how to evaluate transportation things like the Central Corridor light rail. It really reflected that it's the power of communities coming together to address policies that really disadvantage some. Income is a huge issue. So we developed a report on income and health. And from our studies, it really showed that if you increase somebody's income from the lowest 20% up into the next category, you actually could increase their life expectancy by about 3.5 years. That little bit of investment at the low income level is really, really important for health. That it says that we have to take an approach that is broader than what we traditionally have done in the health department. So we're taking now at the health department a health on all policies approach, where we really say we need to partner with transportation and housing and economic development and corrections as a team to create the conditions in which people can be healthy. But do it with a health lens. How does it actually improve health? And with a health equity lens, how does it reduce disparities and how does it advance health equity? So that when the Department of Transportation is building a road, how can we make sure that everybody in the community can benefit, that it actually enhances health as opposed to detracting from health? How does it build the capacity of those communities, build the opportunities in those communities, those opportunities for health? Because we know that if everybody benefits, as Paul Wellstone said, everybody benefits. And we know from the data that if we can reduce the income inequality, everybody's going to get healthier, even the people at the top. So if DEED and economic development looks at economic development through that equity lens and that disparity lens, I think we're going to have a really healthier state. And it'll be because everybody's doing it together. And a lot of it's personal stories of things that I've learned or where I am and what I'm learning from a conference that I'm going at and some of my reflections on that. And I recognize that when I tell a story that reflects about something I'm doing, people often open up and are willing to share a little bit about what they're doing, or they reflect on the same kind of thing from a little different angle. You need to be open, a little vulnerable to sharing a little bit about your personal story, and people will share back.